Sitting in a room of a couple of hundred empowered women feels just like the Labor caucus. I'd first of all like to acknowledge that we're meeting on the lands of the Dharawal people. I know you've already had a welcome to country, but I in particular wanted to pay my respects to our Dharawal Aboriginal medical service, led by the remarkable Daryl Wright, and really an icon of healthcare in Western Sydney. My hero visited Dharawal. His name was Michael Marmot. He was head of the World Health Organisation, World Medical Association, I should say, and he described Dharawal as the best health service he had ever seen. And they have continued their work. I'd like to acknowledge them and acknowledge Daryl and say that I'm respecting them by voting yes in the next referendum on the 14th of October. I have brought some yes badges if anyone would like one. They're most welcome, and I thank you for your support. So Michael Marmot is my hero because he recognised the role that healthcare providers could do in the social determinants of health. And we're seeing what he said almost 30 years ago play out now in the modern Australian society. There is increasing inequality in Australia. One of the figures that I saw was the wealthiest 7 people in Australia, that's 7 people have more wealth than the bottom 20%, the bottom 2 million people. Now that is not inequitable, I don't know what is. And we're seeing that inequity play out across the spectrum of those social determinants, be it healthcare, be it income, being quality of life, being housing. We're seeing that play out now. And we have to change that paradigm. And it was great to hear the young students here today talking about the inequity that we're seeing. And climate change is certainly part of that picture. Those that are going to be worst affected by climate change are the poorest, both in this country and around the world. And that trajectory we need to work very hard to change. We're seeing now in Australia that the minimum wage and unemployment benefits do not allow people to live healthy lives. We're seeing life expectancy in that group of people, the gap between them and the wealthier people playing out. We're seeing housing inequality. We're seeing almost impossible difficulties with access to care, not just in rural, regional, remote areas, but in some of the poorer areas of our major cities. I came into Parliament because I was increasingly concerned about the difficulty that my patients are having accessing care. In things in the paediatric world, as far as last year, there were no child psychiatrists living west of Parramatta. So people with severe mental illness having huge difficulties accessing care. Increasingly, I was seeing my patients with developmental problems, with health problems, not having stable housing. And that makes, as a paediatrician, it almost impossible to support them. If you have a child with an intellectual disability who requires school support, if housing is changing every few months or even every couple of years, it's almost impossible to get stable school supports put in place for them. We are now seeing a problem playing out in Macarthur and around the country. I was speaking to my colleague who's the member for Lindsay, Melissa McIntosh, the Liberal member for Lindsay. They're seeing the same problems in their area where we have some schools that have 40 demountable classrooms. And that is just poor planning and poor support by politicians who should know better. We now have a backlog of supported places in schools, in IM, IO and autism classes in our schools. Almost 30% of kids that will qualify for teaching in those classes cannot get a place in Macarthur as we speak. We're having people who live in some of the newer suburbs that are occurring, having to beg the political class to provide schools and healthcare for them, because they, even though it was promised, it's not being provided in the newer developing areas. So the social determinants of health are the reason that I'm in politics. I acknowledge you heard from Sophie Scoms, the member from Mackellar, this morning. She's one of the new improved doctors in Parliament, and she's doing a great job. And she, her electorate is one of the wealthy electorates in Australia, but even in her electorate there are pockets of people who cannot feed, clothe and house their children. So when that's happening in Mackellar, we know that there's a problem. I'd like to acknowledge also here today Karina Law, my friend and colleague who worked as a GP in one of the local suburbs of Macarthur for many years. And I know that she provided fantastic access for her patients. But that is less and less common in the environment that we live in the outer western suburbs of Sydney. And people cannot access primary care. So we have to look at different ways of providing care. Telehealth is one way, digital health is another, but we need to maximise the use of our health workforce. And that's why I was interested to hear the question about multidisciplinary teams. There is no doubt that is the way that healthcare is going. And I'm an old doctor, and I saw how the system ran when I started work in 1978 as a doctor. But that's no longer sufficient for the modern world. So systems have to change. In terms of women's health, there has for too long been almost a medical apartheid between male and female health. And it's time that women were empowered. One issue that is a huge problem is support for people with menopausal symptoms. Very little. I'm of a certain age, as is my wife, and it has been very difficult to get access to support for women's health issues. That has to change, and we have an assistant minister, Jed Carney, who just this week is setting up a women's health task force that will look at these issues and will try and promote women's health as a primary support around the country. And I congratulate Jed on that. Myself have been I'm the chair of the Standing Committee on Health, and we are looking at how we can get improved fertility services around the country. We're already setting up endometriosis clinics around the country. So times are changing, and we need to use every member of our health workforce, from our nurses, our pharmacists, and our assistant nurses, our allied health staff, to try and maximise the potential of our health workforce, because what we are doing in 2023 cannot be replicating what was happening in 1978. So there is time for change. We have huge problems with housing, and I think that the fastest growing group of people who are struggling with housing are older women. And we know that whilst the number of people who are homeless around Australia is increasing, now about 134,000 at last count of people in Australia are homeless. We know there are literally 2 million people in Australia that don't have stable housing. And the fastest growing cohort of that are women. Now we, particularly older women, the Albanese government just this week has had a major success with the passing through Parliament of the NAF, the National Australia Housing Fund, Housing Future Fund. And that will make a huge difference over years, but it takes time. My personal view is that we need to look at innovative solutions to housing that may require governments to retake the initiative in providing housing. We now live in an environment where even people on medium to high incomes cannot afford to buy a house in Sydney. The new developments that are happening around Campbelltown and around Macarthur are not providing affordable housing. I think the average cost of a house in Oran Park is over $800,000. And we have the highest level of housing and mortgage stress in the country. Many of the new suburbs, Gregory Hills, in particular, the average price there is $1.2 million. These are not affordable houses. We've let developers take the initiative, take it away from governments, and they are not providing affordable housing. And that situation really needs to change. It is up to government to house people. We live in a wealthy country. It is wrong that young people cannot afford to either rent or buy a house in our communities. And it has been a real mutation almost of the housing market in the last 40 years that allows the initiative to provide housing for people to be removed from governments. The National Housing Future Fund will provide around 6,000 houses a year for people fleeing domestic violence and older females who are at risk of homelessness. And that will be an important change. But it is only about 1/10 of what is needed every year for people who require public housing. And so this needs to change if we are to successfully improve the threat of homelessness and housing stress and mortgage stress from our population. I don't want to talk too much more, but the Housing Future Fund, we hope, will eventually be providing support for people who are at risk of the severe social effects of having unstable housing, and that in particular as a paediatrician includes children. So thank you very much for having me today. Congratulations to Zonta for over 100 years of service and advocacy, and it's been a pleasure to be here, so thank you.